Hi there, I'm back. I'm Dr. Vera Tarman, and I am an addictions physician working out of Toronto, Canada. And today I want to talk about benzodiazepines. Now, why would I want to talk about benzodiazepines? Well, let me tell you what they are, and then I'm going to talk about how even though they are a prescribed drug, illicit drug that you can easily get from your family doctor, psychiatrist, in some places you can even just get them over the counter, they are still a drug to be careful with and have a high addiction potential. And so I want to talk a little bit about what that's about. So first of all, I want to say that benzodiazepines are under a class of drugs that are called the sedative hypnotics. And in the sedative hypnotics, we have two categories, the benzodiazepines and the non-benzo hypnotics. Now, the benzodiazepines is what I mainly want to talk about. And the classic ones that we hear all the time are Valium or diazepam, Restoril or temazepam, Ativan or lorazepam, clonazepam or Rivotril, Xanax or L-azepam. You'll notice that a lot of people just know them as the PAMs because that's typically what they're called. And these are classically the benzodiazepines. And although I'm not going to say much about the non-benzodiazepines, they're also considered a sedative, hypnotic, and addiction potential. Those are drugs like Ambien or Zolpidem, Sonata, Lunesta, and Soma. These are drugs that they go to the same receptor sites, but they're not considered a benzodiazepine. And by the way, they're often in the marketplace as these are the drugs that you prescribe patients when you don't want them to become addicted to benzodiazepines. You can give them these non-benzodiazepines, but that's actually just a marketing ploy because you can become just as addicted to those as you can to the benzos. Why? Because they go to the same receptor site. If you look at this slide, this is actually the receptor site that benzodiazepines go to and the non-benzodiazepines, and by the way, also alcohol. Now, I'm going to move over to this side here. This is going to a receptor site. It's not the endorphin or the dopamine or the serotonin receptor site. It's called the gamma aminobutyric acid receptor site, otherwise known as GABA. People just say GABA because it's a lot easier than that big full word that you're going to say all the time, gamma aminobutyric acid, GABA. And above here is the picture of the GABA receptor. And you'll notice that that receptor accepts specific drugs. I mean, it's a receptor that's in the brain, and it function as a neurochemical in the brain is an inhibitory process. It slows a lot of things down. It's throughout the brain, and it's a crucial neurochemical. And the specific receptor that GABA goes to are the GABA receptors. And if you notice in the diagram here, that there's two things up there that say GABA, and the benzodiazepines go to that, alcohol goes to that, and so do those non-benzo drugs. They all go to the receptor site. So it doesn't matter really if you drink or you take a benzodiazepine, it's still going to the same GABA receptor site and has in the GABA context the same effect. And it's often why, and I'll be talking about this in a minute, people when they're coming off of alcohol will take a benzodiazepine because it really is basically a pill form of alcohol in this context. Alcohol, of course, has much more function, but that is a major role of why we use Valium and those sorts of drugs to help people come off of alcohol. And just to highlight, here's an example of sometimes people will say, I don't drink anymore, but they're taking Valium. And just show you that you are, in a sense, you're not obviously drinking, you're not getting the euphoric effect of the alcohol itself, but you're getting some effect that's similar to the benzodiazepine. That's because of the GABA receptor. And just to get a sense of equivalency, one Valium, which is 5 milligrams, which is pretty much the smallest dose that you can get, is equivalent to one Ativan, which is the lowest you can get with Ativan is 0.5, but typically 1 milligram is a starting dose, and those are equivalent to one standard drink. So if you're drinking and you don't want to drink and you want to take a benzo instead, 2 standard drinks would be basically 10 milligrams of Valium. So just it's not always that equivalent because it depends on your tolerance, other things that you're doing, what you're eating, how big you are, male, female, all that sort of thing. But just to get a general idea, that's the equivalency. That's the equivalency as far as it relates to the GABA effect. Now, what is the GABA effect, which we otherwise know as the benzo effect? Generally speaking, just like with alcohol, if people take Valium or clonazepam or Xanax or any of those drugs, a benzodiazepine and also the non-benzodiazepine, because it does give a mild sense of, I wouldn't say necessarily euphoria, but calmness, relax. It's an inhibitory neurochemical. It slows us down. And you just think about why do people drink that first drink? Even if they're not alcoholics, they're just having a drink because it's the end of the day and they're stressed out and they just want to chill. It's the GABA piece that makes them chill. Now, there's other neurochemicals with alcohol that are affected besides GABA that make you happy and hungry and feeling sexual and all that sort of thing. But the part that makes you feel relaxed, chilled, that's the GABA effect. But there's a bit of a mild euphoria, especially if you take more. And when people take Valium, non-medicinally but recreationally, they're usually after that euphoric calming effect, that essentially inhibitory effect. It slows down that critical conscious mind and just helps you chill. If you take too much of that, and we're talking now, so a typical example, I mentioned Valium, equivalent to one standard drink. If you take 10 milligrams, 20 milligrams, 30 milligrams, and you're not yet tolerant, you will feel drowsy, lethargic, and tired. That's because you're so inhibited that you're so slowed down. And the problem, unfortunately, is the euphoric effect. We become tolerant to drugs, all drugs. I've talked about this in my other talk about how addiction develops. But just as a moment here, any drug that you take over time, you become tolerant to, which means that the receptors change they downregulate, and they essentially aren't as effective anymore. And so you need more to get the same effect. I mean, the brain is doing this intentionally. It doesn't want you to have this mild euphoric, drowsy effect. So it tries to buffer that by downregulating. And so therefore you need more. And so if you're chasing the mild euphoria, which is essentially the definition of addiction, when you're chasing something, if you are chasing that mild euphoric effect, and you become tolerant to that, and then you take more to get that effect, you're going to start getting that drowsiness and that lethargy and fatigue, which often is what happens. And in the case of alcohol, because it's the same receptor that's happening here, it actually leads to a sense of depression or almost a mood. You're chilled, but then you're getting too chilled, and now you're actually starting to get kind of depressed. Benzo effects, you start to get this lethargy and fatigue. And then, of course, if you continue to use more, or you mix alcohol, GABA receptor goes to the GABA receptor, benzo goes to the GABA receptor, you're going to end up having a double whammy of sedating effect, which ultimately can lead depression. It's not just mental depression, but actually body depression. You slow down, you can actually have an overdose and die. And how can you die? Because it's called respiratory depression. The system has slowed down so much that the neurons that tell me in my brain, hey, Vera, it's time to breathe because your oxygen is low and your carbon dioxide is getting high, and breathe, that is so slow that I don't essentially connect the dots in time. And so my heart is pumping, it's needing that oxygen, and has a heart attack, and that's the end of it. So respiratory depression is because that drowsiness and fatigue has because of the drugs, the amount that you've taken has actually slowed you down to the point of death. But a lot of people, that doesn't happen. They're not mixing their drinks and their benzodiazepines, or they have a steady dose that they're on. And let's say they're on like 10 milligrams of Valium or 20 milligrams of Valium, because it doesn't take long for you to develop that tolerance. And you're on that for a fairly long time. The other thing that can happen is eventually things like memory loss can happen. And now memory loss, depending on which benzodiazepine you take, there are actually some of them that intentionally want you to have memory loss. And those are the ones that you take when you're going to a medical procedure that's uncomfortable and unpleasant, and they put you under, it's not under like an anesthetic, but it's like so drowsy that you're kind of sleeping and you don't really notice what's happening. They'll do that for that reason, but they'll pick a specific one because they know that you won't remember it. And if you're using that unintentionally in a recreational setting, we call that like the date rape drug. You know, you do something to somebody and you don't want them to remember later what's happened, or you want to instill or promote like a blackout, essentially. And so memory loss is something that some benzodiazepines promote more than others, but any benzodiazepine over a long term can create some level of memory loss. And think about this. A lot of people who are in nursing homes or older people are on benzodiazepines, often because they've been on them since the 1960s and 70s. I mean, they're older people, so they've been on them for a long time. And there we are, we're calling them that they have some sort of dementing process. It could be that it's the benzodiazepines over a long period of time that has contributed to their cognitive decline. And you just take them off of that medication, and they may actually, well, quote, wake up. Now, it's not easy to get off of them. That's going to be the next slide, but it's, memory loss is a pretty significant thing. And the other thing that can happen with older people and anybody who's taking benzodiazepines over time is it can make you really unsteady and slurred speech and impaired movement. And you don't want to be driving a car. That's partly why alcohol, you don't want driving and drinking, you don't want to drink and drive, because you've essentially got a benzo-like effect. And car accidents will happen and whatnot. So these are the consequences of benzos. They can kind of develop if you become tolerant and you want to keep getting that buzz feeling and you increase your dose. You're going to get all of these side effects more and more and more, because the tolerance doesn't seem to develop there as much as it does with the euphoric effect, which is, the thing that happens with addiction often. I want to say something about this tolerance that develops, because it's an important fact. Tolerance with benzodiazepines, more than with alcohol, more than with opiates, more than with almost any other drug, happens very quickly. It can happen continuous use every day, even up to 7 to 10 days. What does that mean? I've got here from 2 to 4 weeks, and that's because the pharmaceutical companies will give that warning. But Health Canada, which is our equivalent in Canada to the FDA in the USA, say, it doesn't have to have 2 to 4 weeks. It can be 10 days. And what does that mean? That means that if you're taking a medication, probably on prescription, because usually a prescription is 2 weeks, maybe a month. If you're taking it continuous use because of anxiety or panic disorder or insomnia, that means that after 7 to 10 days, you need that drug just to get to space one. You become tolerant very quickly and dependent very quickly. Now, if you're trying to chase that buzz, that euphoricness, then that's adding the extra piece that we call an addictive behavior. It may not actually be a full-blown addiction, but addictive behavior is starting to develop, because that's when you're trying to chase something that you no longer get because you become tolerant to it. But this tolerance is a real pain, because why do people take benzodiazepines? They want to chill, they're anxious, they want to cool down, and after 7 to 10 days, they need that just to be on square one, and now they need a little bit more to get that chill feeling. So it doesn't take very long. So we really recommend that if people have to take it sporadically, not continuous use, before they develop a tolerance. Now, if you are taking it already and you've been taking it for years, don't take it sporadically. You have to wean off. But as you're starting the process of it, because something's happened, something very traumatic has happened, and you need a little bit of something to get to sleep, fine, but try not to take it on an every night basis, because you'll be really sorry, because you have to get off of that stuff. And that's the next thing that I want to talk about is, okay, now you want to get off, we call it benzo withdrawal. Now, benzo withdrawal is benzodiazepine withdrawal. This is where you try to get off of this medication, and the tolerance has taken not very long to develop, and that means that now you need more to get the same effect. It also means that you become dependent. That means I need something or else I will be in withdrawal. Now, I may not be chasing the high anymore, but if I've been taking 5 or 10 milligrams of some benzodiazepine for more than 10 days, 2 weeks, maybe a month, maybe 2 years, 3 years, I need that drug or else I will have withdrawal. And the withdrawal is really difficult. Number one, any drug that you take, when you get off of it, the opposite effect happens. So if I've been taking it to chill or to feel less anxiety or to deal with my panic attacks or my insomnia, take myself off of that drug right away, and I'm going to be super anxious, super panicked. I won't be able to sleep. I'm going to have definitely insomnia. We even get physical symptoms like pins and needles and just real physical discomfort, sweat, sometimes diarrhea. It's a very unpleasant feeling. And remember, benzodiazepines go to the GABA receptor, same as alcohol. Think of what alcohol does: shakes, sweats, seizure. And similarly with benzodiazepines, you can have a seizure. In fact, when we talk about withdrawal, the two drugs of withdrawal that can kill you are benzodiazepines and alcohol, because you can have a seizure and die. fall and die if you're alone. I mean, it should be a medical detox. It should not be a circumstance where you're drinking and you say, hey, doc, can I please have some benzos? And then you go off on your own, not in a detox setting, not in a supervised setting, and you either drink too much and take the benzos, overdose, or you stop drinking and take the benzos and then stop the benzos, and like you don't know what you're doing. You can either way, you take too much or too little, and you can fail. It should be a medical detox. So benzo withdrawal, very unpleasant. Other reason why it's unpleasant is it's long. It's so long. Such a long detox, it's not even crazy. And this is the reason why I really dislike this drug. It's like a pesky little irritant. Alcohol, remember, same GABA receptor. When you stop that, it has a dramatic effect. You see it. We have, scales to determine when a person is in alcohol withdrawal. How sweaty are they? How shaky are they? Are they potentially at risk for seizure? What's their mood like? We're asking all sorts of things, and we care because the person can have a seizure. And this is a diagram that I just want to show you to contrast with benzodiazepines. So this particular one is days. So the bottom line here is days after cessation of drinking, which is it looks like about a week. And the other category is the withdrawal symptoms. And so the blue line, the stark blue line, are the seizures. And seizure potential is within the first 3 to 5 days. This is all GABA related. And then the other stuff, the motors and the shakes and the sweats and all that stuff, that's the other little thing here. Basically, all the other lines are the other symptoms. Most of this stuff, as you'll see, is done after 7 days. Now, the seizure profile or threshold can be as long as 7 days, but the biggest worry is in that first 3 to 4 days, which is why when you go to detox, it's typically that long. And then they say, okay, it's time to go. You don't need to be here anymore. So that's an alcohol withdrawal. Medical withdrawal, serious, and we use benzodiazepines to mitigate that potential seizure. This diagram, look at this. This is, remember, benzodiazepines, same GABA receptor, but it takes a long time. It's not as dramatic. You're not necessarily going to have a seizure. You could. You're not going to have as many sweats and shake and feeling nauseous and all red. Like all the symptoms of alcohol withdrawal are not as evident. It's a little bit lower grade, but it lasts a long time. You got to pick your hell. Are you going to get it all over with quickly, or not so much, but taking a long time? So the first bit, so this diagram here, which is thanks to a treatment center called Harmony Ridge. I just want to give credit to the diagram because I didn't make it. This diagram, it's a great diagram. So it shows 1 to 4 days is that same similar thing that alcohol, the anxiety, the sweating, the headaches, the panic attacks. And if you're on a very high dose and you stop, yes, you can have a seizure. Not that common, but it's possible, especially if you've had a history of seizures in the past. So 1 to 4 days, that's understood. But now look at the next one. There's still a potential for seizure. Hallucinations, yes, you can have hallucinations. Depression, weight loss, because you don't want to eat, you can't sleep, can last up to 19 days, 20 days. We're talking 3 weeks here of discomfort. So it's a hard drug to get off of. And then notice this, the red one here, where it's reduced symptoms, but it can persist for 1 year or more, depending on the severity of the addiction. It can last a long time of feeling uncomfort, of having more anxiety, of having insomnia, you don't sleep. There's a rule of thumb that we have in the field where we say for every year that a person has been on a benzodiazepine, and some people have been on them for years, for every year it takes a month to get off. You will get off. And I've seen people 6, 7, 8 months later where they were shaking when I saw them, much better after 6 or 7 or 8 months of no more using. So yes, you will get off, but it's pretty uncomfortable in that time period until then. So they're a drug that just because you didn't know that it could take 7 to 10 days, obviously, it's not going to take a year to get off of something that's 7 to 10 days, but it's an unpleasant withdrawal. And if you don't know that, it's one of those drugs you want to think about taking, like I said, on a regular, continuous basis. They have a great effect on a short-term basis. If you've got to go into a CT scan, if you have to sleep because you're on a flight and I don't know, something like that, or you've had a really traumatic event and you just need to have something to put you out, fine, but don't be taking it on a regular basis. Don't take it on a regular regular basis for sleep, insomnia, which means that you might be needing something every night. There are other drugs. They may not be as effective because they don't have that chill effect, but you won't pay the cost of withdrawal. That's my talk on the GABA receptor and benzodiazepines. And remember, I mentioned, I'll just finish off by saying the non-benzo alternatives, which the pharmaceuticals have said, hey, you don't want to prescribe a drug that's so highly addictive. Give the non-benzos like Ambien and Sonata and Imovane and all of these. It's just hype. They are just as addictive.